Hello, this is Dr. Stanley Lang, and the subject is memory loss Lyme disease? And the first time that I had to encounter this question was more than 10 years ago with a patient that was in his 20s. Now, at that point, I had never seen a patient who had had significant memory loss because of Lyme disease. And with this particular person, it was obviously not normal for a 25-year-old man to start to develop significant memory loss, but he was basically acting like somebody with Alzheimer's disease, and he'd had such significant memory loss that he couldn't work anymore, and he was desperate, of course, to find out what was going on. And the test in that case was positive for Lyme disease. We treated him with fairly simple treatment, and he did get better. Then about 2 years later, his symptoms came back exactly the same. And now I've seen him a third time with recurrence of Lyme disease, with the recurrence of memory loss, which I believe is related to Lyme disease that never completely went away. Now, for a patient who is in this age group, it's pretty clear that this isn't typical dementia going on. And so that doesn't get brushed under the rug so easily. But for patients who are older and they have memory loss, then the question, is the memory loss Lyme disease, becomes a much harder question to answer, because many times the memory loss associated with Lyme disease looks exactly like what we call Alzheimer's dementia. Now, I've had multiple patients who have had significant memory loss that improved with treatment for their presumed Lyme disease, because in this case, the Lyme test was negative. But I've come to, with many other physicians, doubt the accuracy of the test. I don't rely on it anymore. Certainly, if anybody has symptoms that even resembles the possibility of Lyme disease, I offer the possibility of treatment, even if the test is negative. And in this case, this patient has gradually recovered her memory over the last, I'd say, 9 to 12 months. And she's at a much more functional level than she was just a year ago. And she would have been treated as the average Alzheimer's disease patient. Now, one of the reasons that I want you to be aware of this is because one of the problems with a trial of treatment is that you have to put the person on antibiotic therapy. First of all, that requires a doctor's prescription. Second of all, long-term antibiotic therapy for Lyme disease affecting memory can be difficult to tolerate. So the natural Lyme disease treatment program that we've developed, it's working well for patients. We don't have exact statistics at what percentage of people will get better following the program, but we have patients who are getting better following the program. And so I want you to at least be aware of that possibility, because if there is memory loss and there's a concern that could this be Lyme disease, a trial of treatment using the strategies within the program, I think, makes perfect sense, because otherwise you just don't know whether it could have been the cause or not. A recent, very well-known musician, Kris Kristofferson, was diagnosed as having dementia, Alzheimer's dementia, for years, until somebody correctly diagnosed him as having Lyme disease. And so this is going on more than we know. Obviously, we don't know how much it's going on because we don't have accurate Lyme disease tests. But it's something to consider when you're having any kind of a mental status change, but especially memory loss, where it's kind of subtle and it looks like the typical memory loss associated with age. People often don't think of Lyme disease, and I'm encouraging you to at least give it a thought. Now, the context for everything that we teach in our programs is whole person health. That's health of body, mind, and spirit. I think that's the best way to get better. And the programs that I create focus on this kind of approach to wellness and disease recovery. So I hope that you found this information helpful and able to think a little bit more broadly about memory loss. And the question, is it Lyme disease, I think is one that should cross our minds more often than it does when somebody presents with memory loss. I'm not trying to say that all dementia is memory loss, the minority of, I'm not trying to say that all dementia with memory loss is Lyme disease. In fact, I'm sure the minority of it is, but some of it is. There's no question about that. So I wish you well. God bless and have a great day. Oh, by the way, click on the link below the video if you want more information on this natural program. I wish you well and have a good day.